Hello everyone, and thank you for watching. Today we're going to be discussing Nclex-rn 5 questions. I want you all to pass Nclex. If you like this video, please subscribe, thumbs up, or visit me at nclexprep@outlook.com. So, what we're going to be doing today is we're going to go over each question. First, on Nclex, if you want to pass the Nclex, and I'm sure you really do, you need to be careful and read the question very carefully. 2, you need to read all the answers. 3, you want to rationalize all the answers and think about why you're answering this particular answer, why you're choosing it, or why you're not choosing the other ones. You want to eliminate 2 answers and keep 2 best answers, and then, only then, you make your selection. So, what we're going to be doing, let's discuss question number 1. We're going to be reading all the questions together and answers as well. So let's begin. The nurse in a locked psychiatric unit is administering morning medications to a patient with schizophrenia. The patient refuses and says, "I'm not going to take that." What is the nurse's best response? So these are the key words. He's refusing, and what is the nurse's action? So let's take a look at the answers. 1, the doctor has ordered it for you, so you have to take it. Number 2, you have the right to refuse this medication, but the doctor may get a second opinion and have it ordered as an intramuscular injection. 3, why not? This medication will make you feel a lot better. 4, you do not have the right to refuse this medication because you're in a locked unit. Okay, number 1, let's eliminate 2 answers here. The doctor has ordered it for you, so you have to take it. So this is a forcing situation. Can the nurse force the patient to take the medication? No. We're going to eliminate number 1. Good. I want to take a look at number 3 as well. Why not? The nurse is asking. Never on Nclex ask why not. This is not going to be the right answer. Now, number 4. The nurse is stating that you do not have the right to refuse this medication. At any point in time, a patient can refuse treatment or medication. So this would be likely not the right answer. So the only correct answer is saying that you have the right to refuse this medication, but the doctor may get a second opinion and have it ordered as an intramuscular injection. Let's look at the rationale. A locked unit does not mean that the patients are forced to take their medications. And again, you cannot force to take any treatments to the patients or medications. Okay, let's go ahead with number 2. A patient comes to the ER complaining of joint pain that began in his great toe. Which of the following risk factors, if seen in the patient's history, does the nurse suspect triggered at the patient's condition? So here we have the key points of joint pain that began in his great toe. So we need to understand the signs and symptoms of which disease in here. I'm going to give you a clue. The clue is gout. If you don't know what gout is, please take a look at the definition, signs and symptoms. So let's take a look at the answers. 1, lacked a vegetarian diet. 2, smoking. 3, vegetarian diet. And 4, 1 glass of wine weekly with dinner. Let's eliminate 2. So with these types of questions, when you see something like similarities, like these 2, they would probably not be correct. So we eliminate these 2 right away. Now, if we know what the gout is triggered by, we would go straight to having alcohol. So number 4 would be the correct answer. Smoking would absolutely not be correct. So let's take a look at the rationale. Pain that began in the great toe is caused by the gout. The condition is triggered by meats, dense proteins, or alcohol. Good job. Let's go to number 3. Which of the following situation is an example of negligence? Big one on NCLEX. So let's take a look. 1. The nurse observes the UAP enter the room of a patient and on contact precautions, wearing gloves and gown. 2. The UAP fills a water basin with warm water while the patient with depression combs her hair. 3. A nurse describes a new medication order, Quatron powder, 2 ounces BID with wet food or 1 glass of water. 4. The nurse checks the distal pulses of a patient's legs 2 hours after they have returned from the cardiac catheterization. So again, let's eliminate 2. Now the question, be careful, is asking for the negligence. Not what is the right answer, but what is the wrong answer here. Okay, so we're actually eliminating the right answers. We're looking for the wrong answer. Now 1, the nurse observes the UAP enter the room of a patient on contact precautions. We need to know that on contact precautions, wearing gloves and gown is the correct answer. So this is not going to be the right answer for this question. 2, the UAP fills a water basin with warm water while a patient with depression combs her hair. So a patient with depression is combing her hair, okay, and she's not neglecting him by filling him with warm water because she's with the patient performing a procedure. This is not going to be the right answer. Let's take a look at number 3. A nurse transcribes a new medication order with wet food or full glass of water. This does not seem like to be a neglect. She's not leaving the patient. She is again preparing a procedure. Number 3 is going to be wrong. Number 4. The nurse checks distal pulses, so she's performing an assessment on the patient. Here's the key words: 2 hours after they have returned from the cardiac catheterization. Can a nurse perform an assessment, especially after cardiac catheterization or any other procedure, 2 hours after? This is a very big gap. This is the very, very big one. So it's right there. This is a neglect. Let's take a look at the rationale. The nurse should have checked the patient's distal pulses immediately after the cardiac catheterization. Assessment must be done immediately. You cannot wait 5 minutes. Sometimes it can be critical. Okay? Sorry about that. Question number 4. A patient is diagnosed with DVT, deep vein thrombosis. Which of the following, if stated by the UAP, requires intervention by the nurse? Again, let's take a look at the answers. 1. I'm going to ambulate the patient to the bathroom and assist her with using the toilet. 2. The patient states that her leg is warm, swollen, and painful. 3. Sometimes I wish the patient would talk a little less. It's hard to get out of the room. 4. The patient and I were talking and we both play softball. Let's eliminate the 2, okay? So let's start with number 4. The patient and I were talking and we're both playing softball. Well, that does not require an intervention by the nurse. It just has a neutral conversation with the patient that they both play softball. So this would be, not the correct answer. I'm sorry. Number 3. Sometimes I wish the patient would talk a little less. It's hard to get out of the room. This is again a neutral answer which does not require an intervention. Now, if you don't know what the DVT is, please review the material. Is it The signs and symptoms are warm, swollen, and painful in that specific area. You need to know again the signs and symptoms. And this seems to be the correct information. So we're not going to choose number 2. I'm going to ambulate the patient. Here's the key word, to the bathroom and assist her with using the toilet. If you know that with DVT, the patient should be on a strict bed rest, we're definitely going to choose number 1 because we know that the patient should be on strict bed rest, and that requires nursing knowledge, okay, to answer this question. So please review what DVT is and the signs and symptoms. So on a strict bed rest. And finally, number 5, the nursing team consists of RN, 2 LPNs, and 1 nursing assistant. The nurse determines that the assignments are appropriate if the nursing assistant is assigned to which of the following clients. So basically here the question is asking what can the nursing assistant do and is in their scope of practice. A. A patient diagnosed with CVA 3 days ago who needs assistance ambulating to the bathroom. 2. A patient diagnosed with cerebral palsy requiring medication. 3. A patient with sepsis who needs an IV push medication. A client with colostomy requesting assistance with irrigation. So let's start again with number 4 and eliminate the 2. A client with colostomy requesting assistance with irrigation can be a LPN. And of course an RN, but an LPN. Number 3, so this is not going to be the correct answer. A patient with sepsis who needs an IV push medication. This is going to be an RN. Only RN can perform this procedure. Number 2, a patient is diagnosed with cerebral palsy requesting the medication. This can be again an LPN. And it is within her scope of practice. Now look at number 2. Number 1. Number 2 is done. A patient diagnosed with CVA. Here's the key words. 3 days ago. Who needs assistance? Ambulating to the bathroom. It is within the scope of nursing assistant, and ambulating is also within the scope of a nursing assistant. So that is going to be number 1. So the correct answer is number 1. And if you do want to know the differences between the RNs, LPNs, and nursing assistants, please let me know. And I'm going to do a video on the differences between the 3 specialists, okay? So the correct answer is 1. And the rationale for that is the nursing assistant can walk patients to the bathroom. The patient with cerebral palsy and the client with colostomy can each see an LPN. The patient with sepsis needs an RN. I hope that this video was helpful. Great job everyone, and thank you for watching. Click to subscribe if you like the video, thumbs up, or visit me on nclexprep@outlook.com and I can help you answer the questions, okay? And take care. Thank you for watching.